Good afternoon. I'm Ed Ullmann from Wellness RX Pharmacy. Today, we present to you the last module in our series on the American healthcare system. We end the series with the most urgent question. Can we continue to spend 18% of our wealth on healthcare services, or twice as much as most industrialized nations, and 100% more than what we spend on public education and our national defense? Let's be honest. We know that we have a runaway train going on here. And coming out of COVID, it has only made it worse. And the urgency of moving is going to become more and more clear to us. I think it's time that we start to challenge our policymakers and ourselves with the tough questions about our healthcare spending in this country. It's time to deal with reality, or I can assure you that the medically uninsured is only going to go up. I can assure you that the rationing of care, which is occurring in very subtle ways, like in a shadow, is going to be forced up to the sunlight, and we're not going to like those choices. And I can assure you that the shifting of costs from employer to employees in the form of deductibles and co-payments and cost sharing for premiums will only go up if we don't do something. And we also must understand that if we do not get a handle on healthcare costs, then the continuing consolidation of healthcare entities, organizations, large corporations that are controlling regional healthcare decisions, and there's only a small amount of them every year, so more power in the hands of few, is not only going to continue, but it might be the only option we have to buy time if we don't get a handle on this 18% of spending. And I think we also need to understand that this scab was removed during COVID to let us know how different public health delivery is from healthcare delivery. Now, that is not good. Those two things have got to be able to come together more and in a more efficient way. And otherwise, it only adds more costs to healthcare, not less. I say we start looking at this pragmatically. At what steps can be done in the middle, or steps that most Americans, most public officials, and most providers of care will feel that are reasonable. And in this vein, I say we start at the federal level, where public funds through Medicare, Medicaid, VA hospital, and so on, now accounts for 57% of all healthcare spending. So put it into context. We have 18%, all right, but 57% of that are public funds. So if we're going to have any change, we've got to start there. I say we establish a national cap on healthcare spending at 18% of our wealth. So we don't have much room to go. We're already there. But the government can do this. And then they should push that down to the states and get out of the way. And by pushing it down to the states are then going to have global spending budgets that they then can work together with the providers of care, with the insurers of care, to come together and form regional global budgets adjusted on the way they want to do it. So it's going to be by population, it's going to be by past experience, it's going to be by unique characteristics of each market. But we can do this together to be fair. And if they want to, when they push down the risk of the money, to the providers and the insurers. They can make different provisions. They can establish a uniform, what we call reinsurance policy, which means that they say that any high-risk citizen in the state that has maybe over $1 million of total health care claims in any year, that money would then go to the community chest or reinsurance pool. If they want to tie and link the annual increase of the requests from the insurers for premium increases, they could link that to the performance of the state or the performance of the individual insurer. So they would have a lot of flexibility, but the main thing they have to do is to be able to push down the notion that there is a limit, that's what a global budget is, to the individuals who are responsible for delivering the care and ensuring the care, and then asking the public to do their fair part. Now, this push down of global budgets to the states will then force the alignment of public and private interest for cost containment and quality of care. I like to look at it as a mutual accountability for the structuring of a sustainable healthcare system for tomorrow's kids. This is not just going to happen out of magic. It's going to take a working together of the different parties with a sense of fairness. Now, in this model, I suggest that the states first look at partnering with the HMOs or the managed care organizations that are licensed to do business within their jurisdictions. Now, I remain disappointed. I spent many years in the HMO business that the HMOs got bigger and bigger and became more and more bigger insurance companies at the expense of healthcare delivery, because they are challenged by the state to combine both the insurance of the care and the delivery of the care. But the HMOs have shown that they're grounded, that they're stable, and they have an established history of performance. And they do understand about risk sharing, the importance of it, and how to do it. So I say to the states, look to the HMOs. And I also will say, look at the Medicare Advantage plans in particular. Now, they operate on a risk type basis, the same as what I'm talking about. So at Ullmann, for instance, I am a senior. Let's say my Advantage plan that I have with MVP locally pays, say, $3,000 a month for my care. Well, MVP will do very well for me because I don't use many healthcare services. Somebody else might use 4 times. But when it averages all out, what we found with the Advantage plans is that the HMOs can increase benefits if they want to be more competitive. They can increase preventive health care if they want to be more effective. But we're on the same side. They want to keep me healthy and they want to make a profit. They're giving good benefits to me, so I am happy with that. And then they retain the ability to push down into risk sharing with the contracted providers of the care. This works. Let's do more of it. I also like the HMOs for a couple other reasons. Again, it's a middle of the road, it's pragmatic, it has worked. But over 70% of Americans now belong to a managed care organization. It's a lot of people. So we're all familiar with it. It's not breaking ground new. And I also like that 60% of the managed care organizations are nonprofits. And I think that's a good trend. So I go, let's look at this, let's spread the risk, let's work together. And then I also really believe that if we push down to global budgeting and greater risk sharing for managing our healthcare dollars, we're going to see a couple things. The first one, it will force greater partnership between healthcare systems that have been growing and consolidating like you can't believe, with the HMOs our government, and our citizens, because they're going to have to be aligned to achieve the same thing. And that's what we need, partnerships. I think we also will finally start to see a true shift away from fee-for-service medicine, where you submit a bill, you get paid for providing the services. We have to move away from that to what we might call value-based medicine, where we are reimbursing our healthcare providers and our healthcare administrators based on performance, based on outcomes, based on accountability. Why we continue to avoid this, especially with the public sides of our Medicare departments, I don't know. We have to go there. Global budgets will push the issue and it will be a win-win. Global budgets are also going to shift us away from the specialty medicine that we have now that dominates, along with high-tech medicine, and move us more into lower cost primary care and preventive health care for our citizens. I also think that the global budgets will push a new era of creativity and innovation in healthcare management and delivery. Now, I've been arguing this. I have never seen a time there is such lack of creativity and innovation. Because what's the incentive? Global budgets allow you to have the incentive. If you can do something better and you've already been prepaid for it, you win. It's fun. And it allows you to have the incentive to keep people well. I think we're going to see more of this. I think we can also see then that this will help drive down this creativity and innovation more at the grassroots and at the local level where the best decisions are made. I think we will see more partnership with the public health in the traditional healthcare systems. I think we'll see better decisions for managing our escalating technology. And I think we're going to see more incentives under global budgeting for consumers to live healthier lifestyles and to become their own investigators for exploring self-care and alternative options like natural medicine. You know, we can delay the ugly decisions on the rationing of care that we mentioned in the last module. Right now it can be subtle among the poor. Sometimes it's subtle on racial differences. Sometimes it's subtle on who lives and who dies based on the benefits that they receive. But we can only look around the world and see that rationing of care is there. We don't want it. We want to limit it the best that we can. By going to a global budget now, we can delay the rationing of care. We can delay the cost shifting from employers to their employees, again in the form of deductibles, co-insurance, co-pays, and who's going to pay for premiums. And finally, I think we have to address the growing medically uninsured and underinsured population in America. We were doing okay after the Affordable Care Act, but we're now back up to 14%. Just not healthy. It just leads to reckless use of healthcare dollars, expensive use of hospital services, and so on. We must immediately expand Medicaid eligibility to every state in the nation. It's going to have to be done by the federal government. It has been so successful in states like New York. Let's do it. It works. In New York, we put about another 500,000 individuals with health insurance under Medicaid. It works. We need to do it nationwide. We need to perfect the Affordable Care Act that was passed in 2014. It was then known as Obamacare. It has done some good things. It has it provided more benefits, like for students up to age, I believe, 26, if they're still in college, so they can get insurance under their parents' policies. We also provided exchanges for individuals and small businesses to buy in. We also provided subsidies for individuals who couldn't afford the full premium. And it overall works. Let's perfect it. Let's get better at it. Let's put down some minimum requirements for any of the health insurance plans that are under Obamacare to pay the providers fair, because many providers are turning away and not offering services to those populations because the reimbursement is just poor. But we can do that. And we must increase the number of residency and training positions available for the growing young Americans. They want to commit their careers to the service of others, and they want to do it as healthcare providers. In our last module, I said the best way to do it is put 0.25% excess tax or access tax on our managed care organizations, which we're going to now be challenging them to grow and take more risk under global budgets. And let's get the individual doctors that we need and the mid-level professionals that we need, and let's reach out to a public-private partnership to get it done. Okay, we now end 7 modules on the exploration of the American healthcare system. I thank you from my heart for any of the modules that you were able to see. My goal in doing this was to have a documentation of what I have witnessed over 48 years of being in healthcare. I understand that, and I welcome challenges from individuals who might argue for or against, but it's my best presentation in an open, honest, fair way, trying to have a middle ground presentation of what I see as the issues and some ideas for us to do it. And it's my hope that by putting a spotlight on some of the hot issues that we are facing together as a nation, I hope we planted some ideas and seeds for taking action for tomorrow's kids. Thank you again.